A randomized trial of epinephrine in out-of-hospital cardiac arrest. Definition: concern about the use of epinephrine as a treatment for out-of-hospital cardiac arrest led the International Liaison Committee on Resuscitation to call for a placebo-controlled trial to determine whether the use of epinephrine is safe and effective in such patients.
Sudden cardiac arrest is a leading cause of death. A lot of victims have no warning symptoms. It just happens. A person collapses, suddenly unconscious and no longer breathing. And it can happen anywhere, at work, at home, or anywhere else. So, what is
Applications in medicine. Epinephrine adrenaline has potentially beneficial effects in cardiac arrest through the constriction of arterioles mediated by alpha-adrenergic receptors. Such constriction increases aortic diastolic pressure during CPR, thereby augmenting coronary blood flow and increasing the chance of a return of spontaneous circulation. In addition, alpha-adrenergic stimulation causes platelet activation, which promotes thrombosis and impairs the microvascular blood flow in the cerebral cortex, which in turn increases the severity of cerebral ischemia during CPR and after a return of spontaneous circulation.
Epinephrine is one of many hormones that is water-soluble, hydrophilic, and therefore unable to cross the hydrophobic plasma membranes of its target cells. Instead, it binds to receptor proteins located in the plasma membrane and does not enter the cell. When epinephrine binds to beta-adrenergic receptors on the liver cell, G proteins on the inner side of the cell membrane are activated.
Pros and cons. Pros: they will result in one extra survivor for every 112 patients treated by epinephrine, more patient survival. And cons: has the potential to worsen brain injury after a return of spontaneous circulation, severe neurologic impairment, and not improve neurologic outcomes.
Epinephrine, commonly known as adrenaline, is a chemical that narrows blood vessels and opens airways in the lungs. These effects can reverse severe low blood pressure. Adrenaline is a hormone that is secreted mainly by the medulla of the adrenal glands and functions primarily to increase cardiac output and to raise blood glucose levels. Epinephrine is normally released during acute stress, and its effects are known to prepare an individual for either fight or flight, which is why it's a primary medication for non-professional.
In Ecuador, according to the data from the World Health Organization, cardiovascular disease are the leading cause of death. Ischemic heart disease are in the first place with a total percentage of 10.3% of death recorded in 2012. On the other hand, cardiac arrest, also related to cardiovascular problems, correspond to 7.7% of the total of death.
A healthy heart beats in a regular and coordinated way at a rate between 60 and 100 beats per minute to pump blood to your body and brain. However, heart disease can cause your heart to suddenly start beating very fast and quiver instead of pumping blood effectively. If left untreated, this rapid heartbeat can cause sudden cardiac arrest and may lead to death in minutes. Many different conditions can put you at risk of sudden cardiac arrest. These include if you have heart failure, if you have a heart that
Conclusion: This randomized trial involving patients with out-of-hospital cardiac arrest, the use of epinephrine results in a significantly higher rate of survival at 30 days than the use of placebo, but there was no significant between-group difference in the rate of favorable neurologic outcomes because more survivors had severe neurologic impairment in the epinephrine groups. Thank you.
Thank you.
Thank you.